The families we will meet in this series are facing one of the most confronting experiences of their lives. Their children are critically ill, and the local hospitals looking after them don't have the specialised emergency care they need.
She's actually getting tighter. I'm not getting on top of it.
Over the next few weeks,
Could you go lights and sirens?
we follow the doctors and nurses who work with NETS, a neonatal and paediatric emergency transport service that brings intensive care to the sick child's bedside, stabilises them,
Right now our focus is on making sure he gets all the right things done.
and then travels with them to a specialist hospital. This gives critically ill children their best chance of survival. Last time, we met baby Joshua, who was born by emergency caesarean in a remote country hospital.
This is for the bag.
Joshua has a potentially serious problem with his lungs and must be moved to a larger hospital with a neonatal intensive care unit. He doesn't need any further medical intervention to travel safely. So, while NET's nurse Rose Brosnan prepares him for the journey,
Well, Joshua's the most beautiful baby.
NET's doctor Becky Torrens talks to Joshua's mum Karen about his transfer.
I'm coming with
You're
him,
coming
yeah,
too, are you?
Apparently.
I don't think we can take you in a helicopter if you've
I
had
know.
if you've had a caesarean.
Really?
You can understand our priority is looking after
Sure,
him,
yeah.
and if you're not well, our attention's diverted from him looking after you.
Yeah.
And you can see
That was one of the saddest times of my life. I'd only seen him once since he was born, and that was in a humidity crib in the maternity ward, and I still hadn't held him, and he was going, and it was really unexpected.
Do you know if there's stress because I've seen him and touched him once since he was born, and I just wonder, him not being around his mum.
I can understand why you're feeling troubled by that, and I think he's going to know that you're his mum, and he's going to know your smell and the smell of your milk and all those things.
She's working very hard. In a lot of respiratory distress.
Back at base, a Priority 1 call has come in about a girl with acute asthma.
But she's frightening me, to tell you the truth. Now, I actually spoke with the adult intensivist, and she said, there's nothing that I could do, actually. You've done everything that I would be able to do other than intubate her.
Colin and Alison get underway as quickly as possible.
Do you want me to do lights and sirens? Yeah, she's vomiting now. I can intubate her, but I just need a bit of assistance, I think. Actually, just another pair of hands who's done a bit of paediatric sort of emergency work, I think, yeah.
Neil, it's Colin here. I'm in the ambulance on the conference.
Who's the ambo?
It's Marty.
Marty, do you want to tell Marty you can go lights and sirens? And,
Marty, could you go lights and sirens? It's worth setting up the CPAP. They're setting up stuff so we can intubate her if we need to when we get there, but they don't have...
My name's Colin Begg. I've worked with NETS for 4 months. I'm originally from Glasgow in Scotland. I chose to work with NETS really to get experience in retrieval paediatrics.
I guess she must be in the ED, and I think it's an adult ED consultant who's not too familiar with kids.
Back in Scotland, we're in the process of setting up a dedicated retrieval service. So getting this experience over here is going to stand me in good stead for when I eventually return back to the UK.
Best case is that she's okay on the CPAP. Worst case is that we tube her. Yeah.
Every day you go into work, you just don't know what might be facing you, which is good.
Thank you.
Hi.
Hello.
How you doing?
Ian Taylor.
Hi, pleased to meet
Heather's
you.
coming. She's in charge of
Oh,
adult
right.
intensive care.
Okay.
Hi. Nice to see
Colin
you.
Begg,
We
one of the
just
NETS
had you
registrars.
through to see
My name's
Yeah, this is Alison, one of our nurses. Hi, Mum. I'm Colin. I'm one of the NETS registrars. Pleased to meet you.
Essentially, she's a child who's had mild asthma in the past.
Right.
And usually
This is Rachel's first severe asthma attack, and it's hard for anyone to predict what will happen.
But she's actually getting tighter. I'm not getting on top of it, okay?
Thanks.
She hasn't crashed on me yet.
Yeah.
She's fighting it, but
yeah.
she's fighting it hard.
Yeah.
It's on the blood gas.
There was a point, actually, that I heard the registrar discussing, and she you know, she wasn't talking to me, but, you know, I could see that she was very worried, and I thought, oh, this isn't good. I knew that getting distressed is not going to help. In fact, it makes the situation worse. And if I got distressed, then she'd pick up on that, and, you know, that wouldn't assist her in, you know, pulling through or not pulling through.
What we're going to do is we're going to put another mask on you, okay? That mask is kind of just a bit like this one, except what it does is it gives you more air.
It's the same as that, but not so fuzzy. Okay? It's all right.
Yeah, you won't get anything in your eyes with this one, okay?
Yeah, but she doesn't like this one.
I know.
Rachel, you're doing really well.
You're doing really brilliantly, okay?
It's all very noisy and hot. Try again. It's a little bit smaller, it'll probably be better.
The CPAP mask delivers quite a blast of pressure. The idea of that being that it opens up the lungs and just takes over some of the effort of breathing.
It's all right, Rachel. Just remember to think about something nice and just take a slow breath.
There has been research.
The team on standby follow Rachel's case with interest.
If you have to intubate a child with asthma, it's very, very difficult.
I mean, I've not intubated an asthmatic ever.
No, I've not either.
They tend to do it a lot.
These informal discussions are a useful way of workshopping situations they may find themselves in.
If you ask the guys here about intubating asthma, they usually start with something like, we don't do it very often now that we have CPAP.
The man fell off the roof. Now I've got her. It's been a night.
You've had a bad shift, have you?
I haven't had much fun.
I think she's relaxed a little bit since we put this on, actually, as well.
And you've got a second IV. Yes.
No. Well, I have to say, I think
It's time for Joshua to leave, and he's wheeled in so his mum can say goodbye.
yeah, can we? Be able to leave a message for them.
I never had any doubts in my mind that anything would go wrong. I just missed him. I wanted to be with him. I wanted to be on the plane with him. Just to see him in this huge, big machine, and he was so little, and I still hadn't held him, and he was going, and I was quite devastated.
Quick recovery.
Carol's coming. Before you leave.
Okay.
Machine that goes pink.
We know how precious he is.
Just to keep you with progress, well, basically what I'm going to do just now is take another blood sample and check the oxygen and carbon dioxide levels in her blood. We'll see how those are, depending on how they compare with the one we did earlier, and depending on what happens when I phone the paediatric ICU, we may decide either to keep her on the CPAP or to intubate her and take over her work of breathing with the ventilator machine. Basically, it's all about, you know, what's safest for her, so we'll just make the decision on that basis, what's safest for her in terms of transfer and kind of getting her over this episode. So we'll know a bit more when we get the blood result back. Yeah, I'll put a little bit of local anaesthetic in just to make it a bit nicer for her. I'm going to put a little bit of stuff into your hand so you don't feel it.
Rachel, it's just like the other one. Sweetie, just listen to me for 1 minute. I'll get Mum for you, but this time it's going to put a little bit of local anaesthetic in there to make it less painful, okay, sweetie? Try not to get upset when it gives you a tiny little pinprick, okay?
Okay. Think of something nice. Have you got any pets? You got any dogs or cats or anything?
We've got fish.
You got fish? What are your fish's names?
I thought it would be just like a pinprick because I said it would be.
And you're going to feel a little bit more sharp. But then it's going to go numb. Okay.
But it was much harder because it felt really painful.
Really brilliant. That's it. All done.
The mask felt weird because I never had anything really on my mouth. It was continuous and really loud.
Of anything here tonight, the thing that I've got on your face is the most important. Okay? It's the most important.
So when she calms down, her recession improves quite dramatically.
Most definitely.
Yeah. That's why.
Any sort of intervention.
Yeah.
Joshua has been transported with no need for further medical intervention on the journey.
All right, we should get this man into a bed.
I think we did a good job of managing Joshua. But the worst part about that was we had to separate him from his mother. They organised for the mother to meet up with him in Canberra, but it's not much consolation at first to her first mum.
Wonderful. The patients that you really remember forever are the ones that really touch you. The ones that actually make you feel something emotional rather than something stressful. It's emotionally very draining, but it's also emotionally very recharging and fulfilling. It's just the most gorgeous thing. Sorry, you're good. And for everything that you give, you get it back.
There you go. Hello.
Hi.
Who's that?
It's Steve.
Hi, Steve. It's Colin.
Beck here, the Nets registrar.
At various stages throughout the retrieval, Colin talks with a specialist at the receiving hospital in a conference call managed by the Nets coordinator.
At the moment.
798. It's just a question of whether she would behave herself for the whole transfer, become more upset.
Does she have her parents with her now?
She's got a mum with her, yeah.
She'll come with you in the ambulance, will she?
Yeah. Sure. I'd be really reluctant to ventilate her.
Yeah, so would I.
The only thing she doesn't have inside you at the moment is an orogastric tube.
We are kind of debating whether
the benefit of having one is weighed against the
fact that she'll freak out when we do it.
I think once she's on CPAP, I think you don't have any choice. I think she's
got to have one. You have to really, don't you?
Yeah.
I think.
Yeah, we'll just go ahead with that.
It's not going to do her any good just to slow up her stomach, is it, either?
No, it's not. It's going to split her diaphragm.
Yeah.
All the rest of it.
Yeah.
We'll just do that.
Getting Rachel to swallow a plastic tube so that excess air can be siphoned out of her stomach is not a procedure anyone is looking forward to.
Right.
But it needs to be done. If Rachel vomits with the mask on, she could choke.
So, how bad does she go, Colin? I mean, she just gets really tachypneic and agitated. She wants to get the gas on her and talking to her and actually talk her through it. I think we could probably just bloody get on with it and shove it down there, to be honest. But I'm not as touchy-feely as some people when it comes to these things. I'm just like, right, stay still, swallow this. Yeah, you know? I'm inclined to agree with you. Yeah.
She'll be fine. Once it's down there, she'll be fine. In the same way that she was fine once we got that down there.
I don't think she's going to... I'm just worried that
She's going to what? She'll get upset.
Yeah,
Narcissus untested and severe asthma.
Yeah.
They didn't want to give ketamine, which was the other option.
No.
And she needs an OG. If we transfer without an OG, it's dangerous. So she needs an OG.
Nasally or orally?
Whatever's easier.
Okay.
Is she the sort of kid that you can reason with, rationally? I'm not going to give her a drink of water. I don't want to transfer.
No.
You can give her some ice maybe and she can swallow it.
Does it?
Ice to suck if she
You
does.
could probably try. Either way, it's going to be... Did you find the suture stuff?
Yeah, I've got the
Back at base, Di and Patrick are dealing with a local emergency.
What are you doing then?
I was just making dinner. I'm in my best place because I've been painting all day.
Off-duty Nets nurse Heather Robb has tangled with a kitchen knife. Her colleagues help her out while they wait for the next retrieval.
You cut it mashing potatoes?
No. And then I had my Stay Sharp knife and I was pushing it into the margarine container and it went straight
Through the margarine
because I was
container.
holding it. Yeah, I was holding it because it was frozen.
We're going to need to pass a tube down to her stomach, like an orogastric tube, to deflate. Obviously, that's going to upset her quite a bit.
Yeah.
I had a conference with my senior over at Kids Westmead about whether we should give her some sedation, but we both felt it's probably not safe to give her sedation because she's having an asthma attack, because that might make her breathing worse.
Yeah.
But as you know, when we try and do any procedures to her, she does get quite anxious.
Yeah.
So what we're going to do is just try and talk her through it as much as we can. Like when we're doing the blood sample, she was, once we put the initial local anaesthetic in, she was fairly calm. So what I'd like you to do is, if you're there, just to kind of be with her and just talk her and try and calm her down while we're doing it. We're not going to do it right now, but I'll ask you that once we're ready to do it. Are you coming back in anyway? Yeah. Rachel, wakey. What I'd like to ask you to do, there's one more kind of yucky thing we need to do, okay? We've got a little plastic tube, a bit like this one here, and we need to put it into your tummy, okay? Alison's going to do it, and she just basically, we'll give you some ice and stuff as a drink, and you just need to try and swallow it down. You think you can do that? You have a drink? Yeah, we'll get you a drink.
You're going to cry, Henry. You're going to cry.
I'm a strong country girl, I don't cry.
When was your last visit?
No, actually, just recently.
No, you should really have it in the bottom, shouldn't she? In the bottom, she should.
Right, can you feel it? Stop bleeding, please. And I can't see. Yeah.
Okay, that's it. Can you hold her head like that? Okay, sweetie. Now, swallow it. Swallow it, sweetie.
No, try not to puke. Good girl. Calm down, Rachel. Stay calm. Stay calm. Like I said, stay calm. You're doing so good. You're doing big, deep breath. Breathe in. You're doing really good.
Have some more. Breathe some of that oxygen.
Just calm right down. I don't need you to scream like that. Just calm right down. You're doing so good. That's coming back up. You are such a star.
Come on, sweetie.
Yes, Mum. Rachel, listen to me. Okay, you got it. No, you're not choking.
You are because it's sitting in your throat, but you're not choking. You're doing.
You just need to relax. You need to relax, okay? Just chill out. You're doing so good.
The stress of a long day needs working off.
So have you saved any children's life this week, Rosie? Just a couple.
For Net's nurse Rose Brosnan, netball's the answer.
I've been playing since I was about 7 or 8, I think. It's just a game that I really enjoy. It's great exercise, but it's also very social. Nobody in the team is a nurse. It's quite nice that everyone's they have very different lives. It's an outlet. It's a good way of getting away from work and getting some exercise.
1. Is everybody ready? 1, 2, 3. Very good. Right. Thank you. Okay, that was really good.
The main thing with her just now is she's anxious, I think. Her asthma's actually clinically getting better. And the fact she's getting more anxious is probably a good sign because she's more able to, we have a sort of saying in paediatrics, if the kids are screaming, then that's usually a good sign. So she's...
That's right.
Yeah.
If they're really quiet.
Yeah, it's when they're quiet you worry. So although I know it's distressing.
I could relate to Rachel's distress because, if anybody has a condition, they do feel powerless and, you're having needles and tubes and all sorts of paraphernalia stuck into you and you feel like you can't do anything about it. But the Nets team obviously had a good balance. I mean, even when they were firm, I think they handled it extremely well. I mean, maybe better than I would have.
Just need to ask you if you've got any questions at the moment, anything you want clarified or come down and explain about what's going on. When she's calm, she's actually really well, but this, for anyone, let alone a 9-year-old kid, it's a really distressing thing to have.
On your way. Drive carefully.
Thank you so much. Thank you, and thank you. Really appreciate it. It was not easy. No.
She's actually gotten feisty because I think she's got better.
She's got so much salbutamol on board as well. She's probably.
Yeah.
But yeah, she has got better. But salbutamol makes you feel terrible. IV salbutamol, I don't know. I'm asthmatic, and just you take it, and just it makes you feel. Not quite. I've never had one that bad.
Gastric tube down.
No, don't. No. It's makes you feel pretty poor.
All right.
Thanks a lot, guys. Cheers.
In terms of the clinical outcome, the retrieval went well. In terms of how we handled the retrieval, I think it was a learning process for both of us because it was one of the first times we'd both been into such a busy emergency department.
We're here at the Children's Hospital. We're just going to take you up to the ward.
Okay, Rachel.
And I think perhaps if I were to do that retrieval again, I would probably be more trying to make the situation just generally a bit calmer.
Okay. Now you're in unit. Rachel from the stand. Colin will hand over to you. I'll just show you which ones were which.
Once she stopped being passive and started to interact with the process, I knew that she was okay.
Say again, darling? I know. So for you to get better and go home soon, we need to put this mask on properly.
I mean, we'd all like our children to be very compliant, but, you know, when they are compliant and they're not responding at all, you think, oh, I'd really rather than sort of help themselves and get really involved in the process and fight for themselves, which she did. I mean, she's a pretty assertive child, and I knew once she started to, you know, get a bit stroppy that would be okay.
I think by the end of the retrieval we were pretty knackered, we were quite tired, but we were quite pleased that Rachel had got better with what we did.
Okay, take care.
When we left Joshua in Canberra, he was waiting for his mum Karen to join him. After 2 weeks in hospital, they're closer than ever.
The experience at the time was really sad. It was one of the saddest times of my life, but it's also been some great advantages. I had 2 weeks of learning how to be a mum in hospital with amazing people looking after us.
Just pretending.
And it feels great now. It's an experience that's brought the three of us closer together. It's been really cruisy. We've got a really good baby though. So, yeah, I think we're lucky.
And remember Jasper, who we met last time when he was diagnosed with bacterial meningitis?
Jasper just didn't wake up that morning. After about 15 minutes of really trying to rouse him and doing things with him to try and get him to stay awake, I realised there was something really wrong. So I panicked and freaked out, as you do.
Got to make sure none of those things gets out of kilter.
I don't think it actually hit us till a little bit later that, wow, he could have actually died. My main fear was actually, what if he comes out, when he comes out of this, what if he's got brain damage, or what if he's not the same little boy that I knew and he doesn't know me, or he doesn't, you know, he can't talk, or he can't hear, or he can't do any of those things. That was the hardest part, really.
And it's probably been one of the most emotional times of my life, and I think it's actually changed me as a person and made me think about what's important to me a lot more.
After just 10 days in hospital, Jasper's made an excellent recovery and been able to go home.
Throw it in the water. Big throw.
Big throw.
When we first came home, he was having trouble walking, and every time he'd bend over to get something, he'd sort of lose his balance and fall over. But I think that was just a matter of him getting his strength back.
It's not until something's nearly taken away from you that you actually realise how much you appreciate it and how important it is to you. And it has changed us as a family. Certainly brought back to bear that family and relationships are the most important thing you can have in life, and that most of the other things are just other things. At the end of the day, they don't have any intrinsic value. You can never buy health. You can never buy family.
Welcome to the main house.
Next time on Handle with Care, a tense time for Becky and Rose as they struggle to stabilise young Jacob Hooley.
That's 50.
Nice evening for a fly.
We meet Net's frequent flyer, Tracy Thornton,
Oh, I'll hold your hand then, okay? And I'll tell you everything that I'm going to do, so there's no surprises.
and we go out in the field with Rachel.